Katie is a 9-year-old Latina girl who was recently diagnosed with juvenile diabetes. Due to her biological parents' struggle with addiction, Katie has been living in foster homes for the past 2 years. She just transitioned to a new foster home and new school, where she is struggling to make friends and manage her diabetes and moderate dyslexia.
Hi there, my name is Enid and I am the registered dietitian that helps Katie with her personal health and nutrition, as well as contributes to her school meal program. I have my master's in nutrition science and dietetics. As a registered dietitian, my job is to provide counseling and advice about health, diet, and nutrition. Part of my job at Katie's school is menu development and food safety. I concentrate on factors like food allergens and nutrition when it comes to healthy eating in the school cafeteria. I also help the school with creating a nutritional and accommodating menu for their students. The other part of my job is focusing on Katie specifically, in and out of school. Food is a key part of a diabetics treatment, and I am here to help determine Katie's food needs based on her lifestyle, medication, weight, and health goals. Since Katie is still young, a lot of my suggestions are preventative measures. Monitoring blood sugar is important to reduce the chances of hypoglycemia, and what she eats can greatly affect her blood pressure or blood fat levels.
Hi, my name is Emilee Sullivan. I'm Katie's clinical researcher. I have a master's in clinical research. To help Katie out, my job would be to make sure she is up to date on the latest medicine. Medicine is always being improved, so in order for Katie to improve and learn to control her diabetes, it is important for her to stay up to date on her medication. I'll be looking over and following over all the protocols. I will also make sure she stays on top of her appointments and doesn't miss any. I will also keep up with her medical records and make sure all her data is up to date, making sure that Katie is being properly taken care of, and making sure she is getting the right amount of exercise and eating the right amount of food is also very important for her. As young as Katie is, it is important for her to make sure she keeps up with her medicine and remembers to take it.
Hello, my name is Hailey. I am a health and physical education teacher at Katie's school. I have a bachelor's degree in health science and education. As a physical education teacher, my job is to organize games and challenges that help promote physical activity in age groups K through 12. The other half of my job is a health educator. A health educator's job is to educate students on nutrition and diet, disease and illness, drug and alcohol abuse, sex ed, and the importance of a healthy lifestyle. I help Katie in physical education by being aware that Katie has diabetes so that the exercises being taught do not push her physical abilities. If Katie needs to check her blood sugar, I am aware and send a friend with her in case she collapses on the way to walking to her kit. By recognizing that Katie has diabetes and knowing the signs of high and low blood sugar, I can help her to the nurse. There, she will get the medical attention that she needs. I also carry snacks to raise and lower her blood sugar if Katie shows signs of mild, high, or low blood sugar. I help her in the health aspect of my degree by showing Katie how to eat right with diabetes. There are certain foods and drinks that can raise or lower her blood sugar too much, so I teach her to be aware of those things. I also teach Katie how certain exercises are just right for her condition.
I agree with all of your health care programs for Katie.
I think you all brought very valid points to the table.
I agree with all this as well. I think we also all agree that there can be 2 other health professions that would benefit Katie, which are a public health educator and a rec therapist.
A public health educator would be beneficial to Katie by promoting a healthy lifestyle for Katie and finding new ways to help her manage her diabetes. A public health educator requires a master's in education as well as a bachelor's in public health.
And I think a rec therapist would be beneficial to Katie because it would push her for her physically in the activities. It would also benefit with her dyslexia aspect by taking part in different activities each day. A rec therapist has to be a bachelor's in rec therapy and then get their license to practice.
Hi, so my name is Mollie Brown, and my job as a part of Katie's care team is her social worker. So I help Katie with her parents' addiction, just dealing with aspects of that, and I also help her deal with her new foster home and her new school. So I'm the designated school social worker, which means I help all the students with their mental health, their behavioral health, academic standing, and all their social concerns. And since I am the school social worker, I cannot facilitate visits, which is what social workers usually do, but I am able to give her consultation about how to deal with transitioning between foster homes, because that can be really difficult when you also have a parent with addiction. And something like this can be very traumatic for a child, so my job is basically to give Katie emotional support from someone that she can trust, because a lot of her relationships are most likely skewed because of her issues with her parents and just transitioning to a lot of different foster homes, so I can help with that. And I can also establish connections between Katie and her peers and her teachers and even her foster parents, just to make sure that she has healthy relationships. And this will not only benefit her in school, but it will also benefit her at her house as well.
Hi, my name is Sam Sikowski, and I'm a nurse that helped her with dyslexia by referring her to an eye doctor. I monitor Katie's juvenile diabetes, and I check up on her well-being as well. I referred Katie to a specialist, such as an ophthalmologist, which is an eye doctor. Although, if her dyslexia continued and has not gotten better, I will then refer her to a neurologist. They specialize in brain and nervous system disorders. On the other hand, I am much more involved and helpful with her juvenile diabetes. When she comes in for a checkup, I assist her before she sees the doctor and then answer any questions after the doctor's visit. Oftentimes, I provide her with diabetic wound care. This care is important because diabetes slows the healing of wounds, especially on her feet. Although there are 5 priorities I have to treat Katie's diabetes. I restore the balance of fluids, electrolytes, and the acid balance. I correct and reverse abnormal metabolic functions. I help manage the underlying cause of diabetes and the disease process. I prevent diabetic complications. Lastly, I educate Katie and her foster parents about diabetes and how it affects the body, self-care, and necessary treatments. It is also important for me to not just focus on the physical issues Katie is going through, but also the mental. It is important for me to assess her mental state by a series of questions and building a relationship with Katie. I have established great communication with her by using language that shows consideration and providing sensitive, patient-centered care. Although it is very important for me to consult with knowledgeable mental health professionals so we are all on the same page with Katie's mental state. I also referred Katie to a therapist so she can improve her emotional skills.
Hi, my name is Jennifer Hong and I'm Katie's doctor. Katie has what is called type 2 diabetes. Type 2 diabetes is a chronic condition that affects the way your body metabolizes sugar and develops when the body becomes resistant to insulin. It also occurs when the body is not able to produce enough insulin. Insulin is a hormone produced by your pancreas to lower the amount of sugar in your bloodstream. I believe that Katie has suffered from this due to her inactivity and her struggling ability to make friends in the foster home. Hoping that exercise and a healthy diet will put her blood sugar back on track, and I will schedule a follow-up appointment to check on her insulin and glucose levels. I'm also recommending a registered dietitian that could help Katie with her personal health and educate her on her nutritional needs. If all this does not help, I could also prescribe medicine that could help with all her insulin and glucose needs.